Dear friends, colleagues and partners, as we come together to commemorate World TB Day, we stand together in solidarity with the millions of people around the world who fall ill with tuberculosis every year. We also pause to remember the millions of lives lost to this disease, a disease that is both preventable and curable, yet continues to claim far too many lives. We honor those at the heart of the fight. We pay tribute to the frontline health workers who work tirelessly every day to diagnose, treat, and support people affected by TB. Your courage, dedication, and compassion are the backbone of the global response. We recognize the strength and the leadership of affected communities, families, and TB survivors, whose voices remind us why this work matters and whose advocacy drives change and accountability. And we salute the unwavering commitment of national TB programs, civil society organizations, partners, and donors. Your resilience and collaboration continue to inspire hope and deliver real impact in the global fight against TB. But even as we recognize this extraordinary commitment, we must face the reality before us. Tuberculosis remains one of the world's deadliest infectious disease killer. In 2024 alone, an estimated 1.23 million people lost their lives to TB, and 10.7 million people fell ill. That means that every single day, more than 3,300 people die, and nearly 30,000 people become sick with tuberculosis. These numbers are not just statistics. They represent people, mothers, fathers, children, friends, colleagues, lives cut short by a disease we already know how to prevent, diagnose, and cure. And yet, there is also real reason for hope. Since the year 2000, global efforts have saved an estimated 83 million lives. We're seeing encouraging progress, declines in the global TB burden, expanded access to testing and treatment, stronger social protection measures, and continued advances in research and innovation. While this progress is encouraging, the fight against TB is far from over. That is why the theme of World TB Day 2026, Yes, We Can End TB, led by countries, powered by people, is both a call to action and a message of hope. On this World TB Day, the World Health Organization calls for urgent action across 5 key priorities. First, invest in TB care as a smarter economic decision. Financing TB programs is not simply a cost. It is an investment in healthier populations, stronger economies, and more resilient societies. With sustained political will and committed financing, countries can protect their workforce, support families, and turn the tide against TB. Second, accelerate innovations to reach people faster. Scientific breakthroughs only save lives when they reach the communities that need them most. Today, new diagnostic tools offer unprecedented opportunities to close long-standing gaps in TB detection. For the first time, WHO recommends near point-of-care molecular diagnostic tests, including simplified tongue swab sampling and an innovative sputum pooling strategy. These advances make testing faster, simpler, and more accessible, bringing life-saving diagnosis closer to communities. WHO is also working with partners to accelerate progress through initiatives such as the TB Vaccine Accelerator Council, launched to fast-track the development and equitable access to new TB vaccine by aligning governments, researchers, funders, and industry around shared priorities and coordinated investment. But innovation must move quickly from laboratories to people. We urge countries to rapidly adopt and scale up new tools to ensure early detection and universal access to care. Third, scale up people-centered TB care. TB services must be accessible, affordable, stigma-free, and integrated within primary health care. Engaging civil society and people affected by TB ensures that policies and programs truly respond to people's needs and realities. Fourth, strengthen multi-sectoral action to tackle the root causes of TB. TB is deeply linked to poverty, inequality, undernutrition, and weak health systems. The poorest and most vulnerable communities continue to bear the greatest burden. Ending TB requires coordinated action across sectors: health, social, protection, housing, labor, and education, supported by strong accountability and sustained political commitment. And fifth, protect the progress we have already achieved. Global crisis, economic pressures, and competing priorities must not derail the gains made in the fight against TB. Countries must safeguard essential TB services, prevent disruptions in diagnosis and treatment, and ensure that no one is left behind. All of these actions can accelerate the global response and bring us closer to achieving the TB targets. As requested in the political declaration of the United Nations High-Level Meeting on TB, the World Health Organization will continue to provide global leadership for the TB response, working closely with the countries, communities, partners, and civil society. Together, we will continue this work until every person affected by TB is reached, treated, and cured. Because the truth is simple. Ending TB is possible. We have the knowledge. We have the tools. What we need now is the collective determination to act with urgency, with solidarity, and with courage. The time for action is now, led by countries, powered by people. And together, yes, we can end TB. Thank you.